This is not a drill. Joe Biden has been diagnosed with aggressive prostate cancer. Now, there's been a statement that was released literally minutes ago, and so we're just going to take it from the top. So, a statement from the office of former President Biden says last week he was seen for a new finding of a prostate nodule after experiencing increasing urinary symptoms. On Friday, he was diagnosed with prostate cancer, characterized by a Gleason score of 9, grade group 5, which is the worst, with metastasis to the bone. While this represents a more aggressive form of the disease, the cancer seems to be hormone sensitive, which allows for effective management. The president and his family are reviewing treatment options with the physicians. So, right there, pretty sudden. Nobody saw this coming. Now, I do know some of his medical history, including a brain bleed aneurysm 40 years ago, which is lethal in a lot of cases. He had actually a cancerous tissue removed in 2023 before it became a big issue. But this seems to be in line with what happened to, I believe, Beau Biden also had brain cancer. I mean, so this is not too shocking. However, at 82 years old, going on 83, his odds of surviving are really low. So if you see here, you'll notice that the risk group that Biden would be with a grade group 5 and a Gleason score of 9 puts him in the high slash very high group for risk of death. So it's really bad. I mean, there's several levels to this, obviously. However, again, you're at a very weak position if you're 83, basically, with this problem. Now, if you're curious, like I am, about the survival chance, I just asked GPT and we'll see what we get. So, the prognosis for the survival rate is based on several factors, as we all know. So, obviously, it's according to the American Cancer Society, there's a 5-year relative survival rate for distant metastatic prostate cancer. And so the survival rate for 5 years is 34%. However, he's already in his 80s. And so it complicates things a lot more. Now, just to look at what things they can do to maybe save him, there's hormone therapy. So that would lower his testosterone, which is interesting as a man to lower your testosterone. Now, chemotherapy, again, very brutal to see someone go through chemotherapy. Whatever transplanted hairs he has on his head will be gone after that. And, will you, if you're 83, are you going to subject yourself to several months, if not years, of radiation therapy or whatever? I mean, it's really difficult to say whether or not he will. Also, you look at bone strengthening agents such as, I don't know how to say this word, but it's bischofaphantas or whatever, to reduce the risk of fracture. So again, his bones are weak. And then immunotherapy, which could fight off cancer cells. I also have more specific data. If you look at the age factor, which is the worst thing going for him, you'll notice that the median age for a prostate cancer diagnosis is for men at the age of 66, and that's with a Gleason score of 7. Biden not only has a Gleason score of 9, but he's also got an age above 66 of about 16 years. And so, I mean, the odds of him, which already are 1 in 3 of him surviving for 5 years, is probably looking more like 1 in 15 or something. It just depends on who you ask. Given the lack of odds of surviving this, how will Jill Biden, who's been using Joe as a vessel for her own clout and empowerment, how is she going to deal with the lack of, again, the big guy, as Hunter Biden would call him in emails that were very, very controversial? And what is Hunter Biden going to do when daddy's not around to literally bail him out, whether it be bailing him out of jail, bailing him out of the prison system, bailing him out of drug money debts? I mean, this is a really bad look for the Biden family. How are they going to make it? And they knew what they were getting into when they had an 80-year-old man in office. They knew that the train had to stop somewhere. And so, am I sad about this development? A little bit. Not because I care too much, because I honestly don't. He's already past the life expectancy that I have. So, at that point, whatever. However, him dying soon, which could definitely happen, not that I'm wishing death on him, but him passing away early, and by early I mean like in the next year or two, could bode well for Democrats who want to remove his legacy and get over his crappy administration as soon as possible. So him passing away actually gets him out of the picture and makes him look like a empathetic figure to the public, where we were just on the heels of this Her report being released, where he was clearly in cognitive decline, to put it nicely, and this was about a year prior to the election itself. And these same Democrats swept it up for him until literally like just now. And even now, they'll say, oh, well, I only realized it at the debate, as if that's actually a valid excuse. I mean, that's like if you're hanging around an alcoholic for a week and you're like, only saw him drink beer that one Saturday. It's like, I really sincerely doubt it. So, anyways, comment down below, what are your thoughts? I know there's a lot of mixed reactions. I know a lot of people in MAGA are celebrating this. I'm not. I personally don't care either way. He was going to go any year now. So this just makes it more likely, which I don't know what to feel. I think this helps the Democrats move ahead from his disastrous administration. So that's something I don't want them to get away with. However, that's the news. So like the video if you liked it. Subscribe if you want more content. And I'll see you all in the next one. Adios.